So now that I've said about all the things that we've done well, let's talk about what the challenges are. Let's have a realistic picture of the challenges ahead. So this last year, I still maintain the accomplishments have added to my confidence that we will ultimately, with our great outstanding people that comprise Duke, will be successful and can weather the storm. But I'm not naive. Across Duke, we're wrestling with a number of significant challenges. So at the top is a three-headed monster, I call, which is NIH funding, which has been flat for quite a few years, and of course its buying power continues to diminish. Significant reduction in university endowment and investment payouts, and a tentative philanthropic environment that is certainly most affecting the School of Medicine and to some extent School of Nursing. For the health system, as a result of this economic crisis, we are seeing a reduction in elective surgery, cash business such as LASIK surgery, integrated medicine, diet fitness, etc. At the same time, because of unemployment, there's a growth in uninsured patients. So in addition to the immediate needs of our continued well-being are the economic and financial pressures that emerge at various stages over the next 5-year horizon as well. So, for example, NIH. Well, I mentioned that we're doing quite well with era funding. But after 2 years, there will be cliff-like effects. So we should not look at this as a long-term solution. We obviously have to think about what would that happen when that cliff-like effects hit us. So we have to improve in the way we manage right now. Also, as you look at the school, if you look at its reserves and what it uses in order to enable it to invest in the programs, I would say that if you remember the dollars which were transferred a few years ago from the health system, the $280 million now, is really much less. And if one were to look at either you continue to spend the same rate and the money will run out much earlier than we anticipated, that is in less than 10 years, or that the Dean's office will have to say we have to reduce the budget. And of course, I showed you down here the slide of kind of the things that they've done really well and try to control the budget. So there's a lot of challenges ahead. And of course, I don't know what's going to happen to investment, endowment, or philanthropy. All I can tell you is that a lot of dollars were lost. If you just take the health system itself, it lost about $500 million worth of its assets. So these are really important impact on us and how we do things. But my feeling is we've got to remember why we're here and to focus on our core mission. Now, but there's also the healthcare reform. I mean, all of us know and are hoping that we'll have a healthcare reform. And if there's no healthcare reform, I'm told that there could be budget reconciliation. Whatever the mechanism, that is likely that it will have tremendous cut. If you look at the healthcare reform bills of the House and the Senate, and I actually just got on the phone with Senator Hagan, and she says that everybody's now, people are just showing up in the Senate to listen to the Senate Finance Bill and debating this. But if you look at this, in order for healthcare reform to cover everybody, administration will have to take $500 to $600 million out of Medicare, at certain costs, mainly cutting Medicare and Medicaid. And of course, if you think about public option, well, that's another story. I believe in the public option, but if not done right, public option can actually grossly underpay, us as Medicare and Medicaid does. It pays about 60–70 cents to the dollar. But also it can crowd out private insurance. So if you look at the performance last year, all our margins came from, in fact, the private sector, private insurance. And more, because we lost about $200 million on Medicare and Medicaid. So this is some serious issues. And I've asked Ken Morris, my CFO, to model the potential impact of the Senate on healthcare bills. And this is what it looks like. It's not pretty. If you look at, even though it ramps up slowly in about 3 to 5 years, if it's fully implemented by 5 years on, the red shows you the potential amount of cuts that we will have from reimbursement. Taking the private crowd-out issue aside, you can see that can hit us about $100 million a year. Now, I think what's unique, what's great about the institution is because we are prepared, we're nimble, we can adjust. But I think there will be a lot of issues that we have to address as we look forward to the next few years. So I still say that we're well prepared. I still say that we have an organization that is collaborative, working together, and I'm confident that we will survive and thrive.